Hi everyone, my name is Megan Hicks, and today I'm going to be talking about target costing. Our learning objectives for today are to define target costing, to explore some pros and cons, and then to identify the uses of target costing in a service industry such as a hospital. Target costing was actually developed in Japanese manufacturing industries in the early 1970s, and this was a result of increases in consumer demand for more diversified products in the marketplace and for shorter product life cycles. And it led to the development and planning stages of manufacturing becoming more important than some of the later stages in manufacturing. This is a cost management tool to reduce overall product costs during the entire product life cycle. It involves several different departments and disciplines within an organization, including production, engineering, research development, marketing, and accounting, all working together. And it's seen as a management process focusing on the customer, not necessarily as a cost control technique, although you'll see in some service industries that it is used as such. The use has actually spread due to increasing competition in the marketplace. So companies now have to manage costs from the design stage of the process forward rather than at later stages during production. And they have to launch new products at prices that are desirable to a consumer and limit the potential for substitutes in the marketplace at the same time. So it does become quite a demanding process. The CIMA defines target costing to be a product cost estimate, and it is equal to the competitive market price minus the desired profit margin. So an example of a target costing is if a company normally expects that the profit margin for a new product will be $5 and expects that this new product will sell well at a price of $15, then what should their target cost be? So if target cost is equal to price minus profit margin, then you would take $15 minus $5 and come up with a target cost of $10. So your goal here is to keep your production cost below that target. Some advantages of target costing, there are several. The first is that you'll plan or project costs of products prior to their introduction to the market, keeping you ahead of the game, so to speak. And this will enable you to ensure that low-margin products are not introduced to the marketplace in order to reduce your insufficient returns on those products. This can reduce costs before they're locked in. The research now indicates that 70 to 80% of product costs are fixed during product design phases. So if you're ahead of the game using target costing and reducing those costs before or during the design phase, then you're getting lower costs before they're locked in later on. You can control design specifications and production techniques using target costing because it's geared more towards management and engineering. So instead of using traditional accounting techniques, you'll actually use cost engineering techniques in order to successfully implement target costing. This can highlight problems with your managerial processes early on, especially within specific departments. It is a driver for cost improvements, and it really encourages focus on the customer throughout the entire organization. So you're responding to consumer and customer demands rather than internal demands. There are a few disadvantages to target costing. One of the top ones being that an effective implementation requires detailed cost data, which can be really time-consuming and requires a lot of coordinated efforts between multiple different departments in order to be effective. It also requires willingness to cooperate from top management down, so you have to have a lot of employee buy-in and focus on the customer in order to have this be successful. And you always have the possibility of a lower quality product because you are reducing costs early in your production phase. You may be doing that by using lower quality products on the front end to build your product, possibly resulting in a lower quality product later on. So what about a service industry like a hospital? A hospital is a service industry, and it faces similar parallels to those in manufacturing industries, even though we don't think of them that way. And because of rapidly changing technology in medical and healthcare practices, we have new methods of treating disease states that are constantly emerging every day in the marketplace. These changes are due to either, changes in technology, like having a less invasive procedure performed, or changes in the drug market. So we have new drugs being approved every day and being marketed every day, in addition to new indications for older drugs as well. Treatment protocols can actually be thought of as the product in the healthcare industry, and these were really brought on early in the 90s by the advent of diagnosis-related groups, or DRGs. In the acute setting, we tend to use ICD-10 codes currently, but these are really geared towards the same idea of having a practitioner abide by a specific standardized treatment protocol rather than being able to choose whatever they want to choose for treating a disease state. So the standardization has actually led to cost containment for physician orders because it decreases the resources available at their fingertips and causes them to maintain their costs that way. And it also caused efficiency improvements in other areas of the hospital like pharmacy, lab, or radiology. These are used to manage a variety of areas within the hospital system because of these efficiency protocols that have been established. So department managers are typically responsible for the efficiency of their department. For example, in pharmacy, we work towards containing costs in several different ways by use of special programs for pricing and things like that. Additionally, attending physicians, when responding to their chief of service, like the chief of surgery or medicine, are responsible for all the resources that are utilized by their team. At a teaching hospital, that would include resident physicians, interns, and other practitioners like a nurse practitioner. So target costing has really been instrumental in cost containment within the hospital system. So it can be utilized in either a manufacturing industry where you're producing a product, or it can be utilized in a service industry like a hospital. It has many advantages rather than disadvantages, and really overall it seems like a great tool for cost containment. These are the references that I utilized, and hopefully everybody learned a little bit about target costing today.